What antidepressant medications help depression in African American seniors? Imagine feeling overwhelmed by sadness or lack of energy and wondering if medication could help. Many African American seniors face depression, but finding the right treatment can be tricky. Today, we're going to talk about which antidepressant medications are effective and safe for African American elders. Antidepressant medications work by balancing chemicals in the brain that influence mood and emotions. The most common types are selective serotonin reuptake inhibitors, or SSRIs, serotonin norepinephrine reuptake inhibitors, or SNRIs, and sometimes tricyclic antidepressants. When choosing medication for seniors, especially African American seniors, doctors consider side effects, other health conditions, and possible drug interactions. Research shows that African American seniors are less likely to receive antidepressants compared to other groups. This gap can be due to cultural beliefs, stigma, mistrust of health care, or limited access to mental health services. Despite these barriers, the same medications that help seniors generally are suitable for African American elders. SSRIs like sertraline, escitalopram, and fluoxetine are often the first choice. They tend to have fewer side effects and are easier to tolerate. SNRIs such as venlafaxine and duloxetine are also options, especially if the person has chronic pain along with depression. Tricyclic antidepressants like amitriptyline or nortriptyline are less common now because they can cause more side effects, but they might still be used in certain cases. Other medications like mirtazapine or bupropion may be prescribed based on individual needs and how well the person tolerates side effects. When treating African American seniors, healthcare providers focus on cultural sensitivity. Open conversations about mental health are essential, as some elders may be hesitant to discuss depression or take medication. Monitoring for side effects like dizziness, confusion, or falls is very important because seniors are more vulnerable to these issues. Regular follow-up appointments help ensure the medication is working and side effects are managed. Access to medication and ongoing support is key. Community health workers and trusted local providers can help improve access and follow-up care. Sometimes, non-medication approaches like therapy, social activities, and community programs are used alongside medication to support emotional wellness. Even though effective medications are available, many African American seniors do not receive treatment due to systemic barriers or cultural factors. Families and caregivers can help by encouraging open dialogue with healthcare providers and seeking culturally competent care. Addressing these gaps is vital to improving mental health outcomes. In summary, the same antidepressant medications used in the general senior population are appropriate for African American elders when depression is diagnosed. Choosing the right medication involves considering side effects, cultural preferences, and ongoing support. Improving mental health care for African American seniors requires understanding their unique needs and building trust through respectful communication.